Really acting like one of them patients.
Casey got me in position. So what you do is say, sir, can you actually put your feet here?
But I can't get your feet here, please, like that.
Yeah, I got you. Cool.
Like him. How you doing today?
I'm doing good. I'm doing good. I just came off Wednesday off work, you know. I don't like being here, but
Oh, sorry, you have to get off when you step into the room, in the session room, you have to get off the phone.
I gotta get off the phone.
It's, our protocol. Thank you. Oh, yeah, make sure you got this on.
See,
I'm sorry, I'm supposed to say that, I'm supposed to say that before I sat down.
so anytime I bring a patient from the reception area, I'll always ask them, because I made that mistake. Sir, would you like to use the restroom before we go to the back? Always do that. Okay, what you're doing is not wrong. This is a learning. You see what I'm saying? Now, also, when I sit in the chair, always put this up, because what if I do this? I'll, always make sure. Okay, yeah.
I see that you're not going to
Yes. I guess this one, Dr. Silvio, I was having a tooth that was actually bothering me.
I can check with the doctor.
Cool. Yeah, make sure you do that for there. Yeah.
Okay, I'll bet you. The first I just want to go there, I see your date of birth is May 2nd, 1997.
Yeah. No, hey, but they check this out. How much it costs?
Okay, I did, the receptionist, when, the receptionist said everything, when we walk into the front, and they can better assist you.
Right. Good answer. And what you do is say, okay, so what we're gonna do first, sir, is we're gonna see what I do is when I bring them back, I sit them down. And I say, okay, so what will happen today is, I'm gonna go through your health history, everything with you. Thank you for filling out your paperwork. Okay, I need to review everything with you. After reviewing it, the doctor will come to the room, the doctor will do the evaluation. The front desk will go over all the logistics with you. They'll talk about scheduling and they'll talk about fees. You see how it works? I just eliminated a lot of stuff. So you don't have to say it the way I do, but sit them down and say, sir, so Dr. Shannon will be who you've seen today. Like what I do too is we have our doctors on the screen. I will even point out who the doctor is. This is Dr. Shannon who you'll be seeing today. So I'm going over your health history with you. Thank you for filling out your paperwork. And these are things I'm telling the patient. You say thank you, it's gonna kind of like, okay, kind of break the ice a little bit. And then I will go in and say, so what will happen is I'm gonna go through your consultation, I'm gonna get your blood pressure, so it's gonna be some things I'll get. And then the doctor will come in, do the evaluation. Once the evaluation is done, then what will happen is we'll go up front, the front desk will handle all the logistics such as scheduling, insurance. They will answer all those questions. If the patient was to ask you how much it costs, again, then you say, well, that's not an area that that's not an area that my expertise in. So what I'm gonna do is I'm gonna make sure I get you to people who can give you more information, and that will actually happen after the evaluation. So you will learn that by working with the people who are already in the field. That's why I say you constantly learning. So I just want to give you a little bit, because I can be real rough on her, but I'm gonna be light. Okay.
Okay, so, I see you have your emergency contact.
Now, one thing about it is this, all this information on top, like the emergency contact, all that, that's really for the administrative. The only thing I want you to focus is on, exactly.
Okay. So I see here you're allergic to latex.
Yeah, y'all got latex gloves here?
Yes, we do, but if you're allergic to, we also have discount if you're allergic to latex.
Okay, cool.
And I see you are under care of a physician. I see you have been hospitalized overnight, not for you.
I was in the hospital, I was having chest pain, so you like my cologne?
We role playing. Gotta learn how to act.
Yeah, it did. Come on. Oh, but okay. I wouldn't say that.
Address is chest pain.
Oh, you got a chest, you chest pain. Are you having chest pain at the moment?
Nah, not now, but you know, I was hospitalized about a couple weeks ago. You know, my chest was bothering me. I went to the hospital. You know, I don't know what they said. I just went to the hospital. You know, they gave me some medicine. That was it.
And are you currently on the medication at the
What medicine took?
your chest pain?
Nah, I'm just taking some aspirin.
Hold on, before she continues,
He's great.
did we ask the pain level?
You could. You could.
Pain level when?
Like on a scale of 1
On
to
a
10,
scale
what's
like,
your pain
when
level?
you pain level, on a scale
At
of
that
one to
moment.
10, at my foot.
Very good.
So what's your pain level on a scale of 1 to
You talking about now?
10? Right.
Now I'm good. Oh man, when it was bothering me, oh my God, it was like 10. You know, I went to the hospital. They kept me all night.
You got aspirin, you had a pain level of 10?
Yeah.
Okay, can y'all kind of reception theory? Thank you. But,
You can cut it now.
okay, I do see that you have asthma, and I do see that you did put that you take your asthma daily.
Yeah, I did.
Okay, and I also see that you have blood pressure, have low blood
I'm
pressure,
about to let it
and I
go
see that you
straight
also
up.
put that you take medication for blood pressure. Do you know the name of the medication?
Nah, it's like some like Amlodipine. Yeah, I put it on there. I put it on there. She on it.
And I also see shortness of breath, and that's not as the reason what it causes.
I smoke. You know it's 420, right?
And that's, last thing I is.
Happy 420.
Is your correct pharmacy?
Yeah, it's fine.
Can't
What-
wait
what
to
is
get
it,
out of
medicine
school,
something?
cuz. We
Yes,
going
if
to
you have
fuck
pain,
down, nigga.
if, can I say that?
Good question. So when the way you respond to that, if you want to give me medicine, say, well, what will happen is when a doctor comes in the room, they will make that decision. So they will do the evaluation from that point. If they do decide to
right
give
there.
medicine, the reason why we ask you the pharmacy, so we know where to send your medicines to. So you want to kind of keep it like that. So you always want to kind of keep away from diagnosis saying yes, because I'm gonna tell you what some patients will do. They'll come in and be like, she told me that you were gonna give me some medicine. Now I need some medicine.
And then the whole time, they don't even need the medicine at the end of the day.
And every doctor's approach is different. Some doctors only give medicines the day of surgery.
Yeah,
Some doctors think that patients are seeking opioids.
Yeah.
So they being real straight now what they give it. You had a question?
Will we ask like the timeline of how long you've been taking the medication or the timeline of how long you've been smoking?
So that would be a good question too. And that's when like, and this is where, and you see, I didn't say it, she said, but that was a good point. So it's like, yeah, I've been taking the medicine. Yeah, I've been taking the medicine for the course of the last, so how often do you smoke? I even have a doctor that will ask a question where, can you walk up 2 flights of stairs without any excessive shortness of breath? Because that could be a respiratory issue. You know what I'm saying? So these are things that you're going to pick up on, but those are good points. Those are good points.
So I'm gonna put everything in the system, and then I'm gonna take your blood pressure.
All right, okay, cool.
One thing I'll put everything.
You don't seem happy.
So if he asks for some Percocet, if he asks for some Percocet, do we supposed to get?
You okay today, ma'am?
So if you ask for what?
Like I come here to get my Percocet, you know, cause
Yeah,
some people
and
do.
those are, if a patient, those are red flags. If a patient walk in and asks for the most potent or opioid, we're gonna start thinking and we're gonna see, because we have a lot of drug seekers.
Yeah.
Yeah, they
So-
go there for that shit.
And
And they come just.
and we
to
have a
tell them
way-
this is where-
I have a way that I can check and see if you can bounce around from office to office.
All you
Oh,
gotta
yeah,
do, no, all you gotta do though is keep telling them the medication that they're giving don't work. They gonna keep upping the dose, and then you gonna get to the Percocet.
People be wanting them Percocet.
Everything is money.
Bro, they gave me first when I had my baby in New York. That was
I've
a
never
laugh.
had it.
Why is this funny?
What does it
How
feel
y'all
like?
go from Tylenol to Percocet?
What does it feel like?
I want y'all to,
Oh, I was like-
I want y'all to listen to what I'm about to say to
I was
her now.
breathing here.
I know, it's still
I want you to listen to what I'm about to say to
I
her
felt
now.
high, not a bad high. It was like,
No.
Hey, check this out, right? You like your job? What you like about it?
Having a patient.
That's cool. Hey, so you take the blood pressure, right? cool. That was one of my blood pressure too.
Why?
So what's the like what you look like what the numbers mean?
Just what you're not
I know,
supposed to do.
what was it again?
Karen talks now.
Kira, what sister? I will keep it simple. Well, this is just kind of giving us a measurement of how hard your heart has to work. So we just want to make sure, just check the condition of your heart, your blood pressure. If your blood pressure is too high, then we may have to, you may have to go see a doctor, you may have to take a blood pressure medicine. A lot of patients will tell you they're taking blood pressure medicine, but they don't. I will ask the patient like how often you take your blood pressure medicine. You taking it in the evening, you taking it at night. When was the last time you take your blood pressure medicine? When the last time you had your blood pressure checked? So those are the type of questions that you will see me throw in there if you ever watch me. I actually have one of my coworkers filming one day, not on a patient. I'm gonna ask one of my coworkers to be the patient, so that way you guys can see a natural flow of what we do in the office. I wish I could get y'all to come up there and
Yeah, Calvin, what's up? That's our, is that our trip?
I can ask.
Do you have patients on like dialysis?
Oh,
Run up
yes.
to the
Like-
office.
So, good point. If they are on dialysis, you have to be careful about that because they may have an arm issue. If they're a cancer patient, or they had cancer, you may have to be careful because they say you don't use my right arm. So,
Yeah, like
you
my
see-
mother-in-law, she
yeah, so,
and they say we can use we can only use their left arm, but we only supposed to use their right arm.
well, the Leslie is not gonna have anything for what arm you use.
I mean,
Let me tell you, I have patients who be like, yo, I know there's somebody walking around with you.
I asked about the dialysis because
I was going to shoot this, they go ahead.
my mother-in-law, she's getting a transplant. I don't know if she's able to get worked on.
A lot of times for that's a good question. A lot of times for transplant patients, the doctor will send them in because they want all the dental work done first. If they have work to be done before that. So we get a lot of patients that will come in and say, I'm here because I'm having surgery, a transplant surgery, because what they don't want is for that dental work to get in the blood system and travel to the heart. So I'm telling you guys, what we do is serious. So let's get it be quiet
No,
for a
it's
second.
kidney.
So she can take a blood pressure, give it a few seconds. Instead of you don't get this time, give me something small. That's why, you remember I said that I want y'all to practice with the day blood pressures, because the more you do it, the more comfortable and more easier it's gonna be for you to hear all the sounds.
Where can we find the closest though? I got the.
Oh, 20. It is 420, y'all. Happy 420. I can't wait to get off. Oh, I got to catch up. Yes. They said we could go. She said, no, it's too early. No. It is
Let me ask you a question. Why can't it be, why
I
can't,
am
this is a
laid out.
question for everybody. Why can't it be very good? Now, shoot, anytime I say, why can't it be 130/69, both numbers have to be even on the manual blood pressure. on an automated, it can be even or odd. So if a doctor said, what was your blood pressure? And you were to be like, I ain't good. And then you just give them a false number and he's like, doc goes 131/64. And the doc's gonna be like, take that again.
She said 138 though. That's
She said
too high.
130/6.
So 50.
So the question was, what if you get an odd number? If she would have said an odd number, then I would say she was wrong because you can't get an odd number on the manual blood pressure. Yeah, none of your numbers should be odd. Yeah, because each one of those need points are, it goes 10, 20, 30, 40, 60, all the way up to whatever this highest number is, which is 300. So it should never, each line represents 2. So it should never be an odd number for that.
Never odd.
I know,
So
hey,
how
don't
does
take
she
it easy.
perceive with it being so high?
Say again?
How does she perceive if it's so high like that?
Yeah, my blood pressure is elevated more than what it should be. And one of the reasons I make excuses is simply because of the fact that my doctor's telling me I need more rest. Because when I leave here, I'll probably lay it down at 1 o'clock. I'll wake back up at 3:30, and then I'm gone the whole day. So my body during the day is constantly going.
So how did I get 120/80? Was you like practicing or something?
Nah, because my blood, she took it 2 or 3 times. When she took it, if she waits 10 minutes, it's going to get more accurate.
Yeah, cause it was thumping. Okay.
Caffeine will have a lot to do with it.
I gotta go get my
Like,
kids.
now you good. You sign out in black. You say my pen?
I did. I signed up.
This is the last one, y'all. Okay.
Happy 420, bitch. She finna go do 420.
Oh, I gotta play that.
Yep, you gotta use that one.
I gotta play that role too.
Can I be the doctor?
I'm in my office.
Can I be patient now?
No, I'm in my office process. I want you to watch this. This is part of the whole process.
Hi, Mr. Caldwell. I do have.
All right, so I went to school for 8 years, and that's how you dress me, Mr. Bola.
I'm Dr. Caldwell, I'm sorry. Let me redo that. Hi, Dr. Caldwell.
Hey, yes.
Patient, Mr. Smith in room 1, I did, check him. He's there for removal, but we did do the consult, and I was coming to get you for the consult. I did check his blood pressure, everything was good. He is on, he do take his calcium pump daily, and he take, medication for his blood pressure, and he have some.
So what she did was she told me why they were here. Then she told me anything with health conditions, which is good. Some of you guys may do it different. Like I said, excuse me, Dr. Caldwell, how you doing? Dr. Caldwell, I have a patient. Patient room 1 is for a consultation for wisdom teeth. I went through the health history with them. They are taking medicines. They do have blood pressure. They was hospitalized overnight. They did say they had a heart problem on a scale of 1 to 10. At the time, it was a 10, but right now it's not bothering. So the more information, they know what they're walking into. Don't let the doctor walk in their room and it's a patient sitting in that chair with no legs, and you didn't tell that patient didn't have no legs. Don't let that doctor walk in the room and the patient has some type of intellectual, like they go in the room, they be like, you did not tell me about to walk in here.
But I tell you why they have no legs though, because it could be either from diabetes, if you
Yeah, it could be like,
anything.
yeah, I could be like, sir, when you walk in the room, the patient's in a wheelchair, the patient do have diabetes, they did have surgery. You see what I'm saying? The more I tell the doctor, but when you tell them, the doctor wants you not to be long-winded. They want you to give them a quick summary of what they're walking into. You see how that works? The more informative you are, the more the doctor know what to expect. Like, I even tell doctors this. Excuse me, sir, I'm gonna let you know, but this is how I have a good relation with the doctor. I say, Dr. Shandon. Okay, Dr. Shandon, when you walk in the room, I'll let you know right now, the patient's very talkative. Right? And I said, so when you walk in the room, sir, so now his mindset is get in there, cut the conversation short, and still give him that quality care. Like I learned is this, when you have someone to talk a lot, I don't do open-end questions. My questions are closed-end. Open-end questions means that you ask a question and there's so many answers you can give. Closed-end questions are you in pain today?
Yeah. Yes or no?
Yes or no?
I never understood that though, like when you go to like a doctor's office the doctor come and ask the questions over again. When you go to the next office, they boom, boom, boom.
Yeah, because dentists now, before when I first came to the field, it was like 7 to 8 patients was a lot. Now offices are doing anywhere from 20 to 30 patients. So they're moving fast. So they still want you to still get that quality. It's your job. Only thing I should do be coming in and doing my part, but you handle that. Matter of fact, I had a doctor that I work with, and the doctor, she would go like, if the patient's real talkative, when I see her do this, she's in a chair. When I see her get up and she start like pulling her pants, and then she be like this, and I look at her and she kind of get look at me, and I'd be like, okay, so what the doctor's gonna do is, so right now at this point, I'm just gonna recap everything the doctor said, and the doctor would say, thank you, Sydney. If you have any questions, ask Sydney, and then if I need to come back, that's what I would step in and be like, so what I'm gonna do is I'm gonna recap on everything the doctor said. Basically, I'm trying to get that doctor out of that room.
Yeah.
Or if I see the doctor being long-winded, what I do is this: all our rooms, when you're in consult rooms, they're not gonna be open bay like this. It's gonna be closed door because it patient's privacy. So what I do is I would literally open up the door and slide the door open. If it's a sliding door, and the doctor, when they see me do that, and then the doctor be like, okay, they know they're being long-winded. Sometimes I have to be like this because I have a good relationship. I'll be like, doc, let's wrap it up. Because I got to keep the doctor on track.
Yeah.
You see how I'm working? But that's not going to be you because you first starting off. I have a relationship with a doctor, so I can do certain things that you may not be able to do.
So with you, do they read the chart even when you do it?
Yeah, they do. Nah, they don't go through the whole thing. What they would do, that's the great question. So what a doctor would do is, let me see this. So what a doctor would do is, when they come in the room, they will look and they will sit up there. They will still go and read through this.
They know what questions they're looking for.
Exactly. Because you said, so if I told them they had a heart condition, they know to ask about the heart condition. You see how they know, they said, so I see that you were in the hospital overnight. They want to hear it from the patient, but they have an idea because you gave them like a preview before they came in.
Okay.
So
I'll give them the chart as I'm explaining. They'll be skimming through it as I'm explaining.
Exactly.
Okay. All right. Good night, guys.
Good night, man.
Contact me and see if because I'm gonna be up here Monday and Tuesday, right? Now,
You know, it's time to get the
because-
fuck out of here, cuz. You got no folks in the bed. Leave my brother out here getting straight to it, my nigga.
But that doesn't mean the instructors have a break. Our break is going to be coming in the lab and
Can't
recording.
wait, man.
I'll come home.
Anyway, let me get the fuck up out of here. Y'all got 8 minutes.
You see what I'm saying? 'Cause I'm gonna have other administrative things.
But if all hands on deck, boom, boom, boom.
I'm not sure it's like a calendar break. You know how they used to have teacher workshops? Like teacher workshops in school? I never knew why they have, I think what it does is they give them time to reset and out and get them to reset.
I was
So it's
coming.
on the administrative side,
I ain't gonna lie.
I'm happy that we have a break.
You need
New class starts on Wednesday.
Question.
So we don't have one more lesson?
No, not till Wednesday.
Since Memorial Day fall on Monday, do we still have room that night? Or is it already closed?
It's usually gonna be closed, but I'm not gonna be here. Yeah, you're still on track, because they already calculated all that in.
What a bad.
Okay.
what a drag.
We got some gloves off of.
What a drag. What a drag.
I know, right? She's gonna tell me
I gotta take mine off too. I got work down in the room.
Let me say, hey guys, thank you for your level of patience, right?
Thank you for yours.
Thank you for, I think sometimes,
Yeah.
what I tell you,
I just want to say,
back in 1988, the 420 when it came right.
trying to show y'all something different. Like, when I be
What I tell you, sometimes we sit here like this, like, will you ever see me take my glasses off and do this?
Oh, you walk it down. Oh,
Yeah, I'm screaming on this side. I'm just like, okay. Alright, let me say this one more time.
say he's screaming on the inside.
And the reason why I'm doing that is because I found it I'm trying to be, I'm like
No,
one of
I'm out.
those patient people.
I got one
But
more
what
thing.
it is, I don't want a lack of discipline to
That's what we doing.
interfere with someone else's education they run.
Mhm.
So I have a daughter, I have 5 kids, I have one child that does this, and I have to be like, stop, let's be quiet. Let's
That
be
little girl, we
quiet.
got y'all that, right?
But I'm gonna tell you one thing about it though. I'm gonna tell you one thing about that young lady. That young lady's smart.
Yeah, she is.
That young lady asks all the right questions. But you have to be thinking about it, like, you don't have to put up with, let me deal with it. I'm gonna work with her, but I have to get that out of her because that may be the only, but that girl is on point.
She just goofy.
Yeah, she's on point.
Yeah, she is.
She will see something, I ain't gonna lie to you, she will see something for the first time and look at it.
No, I'm outta here.
And she'll get it.
Happy folksman, y'all.
Me, I gotta maybe look at it. I have to read certain things 5 times before I actually do it. Okay, I got it. I learned